My name is Jennifer Brown. I'm reporting for Advanced Health Assessment at Regis College, NU 650. This is my patient, Christy. Do you give consent to be recorded? Yes. Perfect. Today we're going to be doing the neurological exam. This is going to be your head to toe neurological assessment. We'll start with the cranial nerves. So initially, you want to check, your patient's ability to smell. There are some smelling tubes that you can get that have, vanilla, cinnamon, coffee. Make sure that they're able to smell. You want to do their visual acuity. Make sure that they, don't have difficulty seeing. And then it's going to be their ocular eye movements. And so you would test that by asking your patient to follow your finger. Don't move your head, just move your eyes, and you're going to follow my finger. And you make sure that they don't have any difficulty with their ocular eye movements. Next will be their facial symmetry and also their ability to sense. So here I have a broken Q-tip. One side is soft and the other side is hard or sharp, as a patient might indicate. And so I'm just going to touch this against your face and you're going to tell me which it is that you feel, either soft or hard. You would test the patient's hearing like we did in the head, ear, nose, and throat video with both the Weber test and the Rin test, which would be the tuning fork against their forehead or behind the ear. Make sure that they don't have any difficulty hearing. Of course, in an office setting, if you don't have a tuning fork readily available, it would be making sure that the patient actually can hear you during the exam, is answering questions appropriately, not saying, "Ha, what? I'm sorry, can you say that again?" And then we'll move on to pupillary response. So with a pen light, you want to check pupillary response. Come from the side and make sure that pupil constricts. And again, you should see that the pupil constricts on the opposite side as well. Next, you want to check their swallow and gag reflex. So I'm going to have you open your mouth and stick your tongue and say, ah. And you want to check for the rise and fall of the soft palate and the uvula there. Go ahead and, with a little bit of resistance, I want you to shrug your shoulders up to me. Wonderful. And I'm going to put some resistance against your chin, and I want you to turn your head with your neck. Perfect. And then the other side as well. Excellent. And then stick out your tongue. Excellent. So the tongue should be midline. There's a saying that says, we lick our wounds. So if there was an injury to the brain or the spinal column, and the injury affected the right side, the tongue would deviate to the right and likely so to the left. Next, I want you to raise your knees up, and I want you to go ahead and slide your heel down the opposite shin. Make sure that the patient can do this correctly on both sides. Slide down to the opposite shin. Perfect. You would check the patient's gait as they walk into the exam room. Make sure that their gait seems steady, whether they're assisted with a walker or with a cane. That they, don't have trouble kind of turning to sit onto the exam table or get into the chair. You can also have them walk across the floor with their heel to their toes, in a straight line, turn, and then walk back on their heels, and then again on their toes, on their tiptoes, to be able to test their gait. I'm going to have you stand just in front of the chair here, with your arms up by your side. I want you just to close your eyes and stand as tall and as still as you can. This lets us know if there's a difficulty with balance. So when you have a patient close their eyes, their sense of perception can be distorted if they've had any kind of spinal cord injury or brain injury, and you would see them kind of sway and not be able to hold their balance. Go ahead and stretch your arms out in front of you and put your palms up towards the ceiling. And I'm gonna, with your eyes closed, I'm gonna push swiftly on your arms and I want you to bring them back to the same place. This is what we call the pronator drift. If there was any kind of concern for brain injury or balance considerations, the hands would drift in one way or the other. Excellent. Go ahead and have a seat for me. So as you're checking, you want to be mindful of muscle tone when the patient is at rest, kind of as they're going through active range of motion in the office with you. So one of the things that you would test for is you would have the patient just relax their joints, and you're just kind of articulating those joints and checking for muscle tone, and that would be in the major muscles. So the biceps, the triceps, the forearms, the quadriceps, and calves. Check for your muscle tone. An atrophied muscle is going to be difficult to articulate at the joint. Some stiffness there, whether it's contracture with cerebral palsy or Parkinson's disease, you're not going to get that active range of motion with the patient. I want you to, with 2 fingers, I want you to grab both of my 2 fingers nice and hard and squeeze as tight as you can. I'm going to test grip strength. It should be equal on both sides. An equal grip strength is considered a 5 out of 5. If you find that there's a less of a grip strength, you want to be mindful of things like arthritis and the patient's ability to actually grab and hold a fist around your fingers, and or a previous stroke where they may have some articulation issues or deficit to that side. Next, I want you to go ahead and relax your arms to the best you can. We're just going to check some reflexes. I'm going to bring your sleeve up here. Here you're going to hold mid bicep about 1 to 2 inches above the wrist. And this is the bicep reflex here. I'm going to strike against your hand and you'll see a movement in the wrist. Again, you would do the same thing for the elbow here, and you'll see a movement in the forearm. The tricep reflex is a little more difficult. You have to get the patient to really be relaxed and comfortable here and strike against just above the elbow and the back of the arm. Go ahead and let your feet dangle free. You want to check your knee reflex just below the patella. There's a small notch there, and the patient's lower leg should jerk. And then again, you would do the same with the Achilles, the back of the Achilles, and their foot will jerk up as well. In addition to checking the muscles and the reflexes, you want to check for abduction and adduction and that muscle strength and tone. The strength is the neurological aspect of the exam. So I'm going to place my hands on the outsides of your elbows, and I want you to push against me, and then I'll bring them to the interior, and I want you to pull in, and don't let me move your arms. So go ahead and push out. Good. And pull in. Excellent. I want you to go ahead and make 2 fists, nice and strong, and don't let me break your fist. And that's checking the wrist there. I'm going to go ahead and push down against your arms, and I want you to push up. And again, perfect. Same with the knee and the hips. I want you to go ahead and bring your legs apart just a little bit. And I don't want you to let me push them together. And then bring your legs together, and don't let me pull them apart. Go ahead and let your feet dangle. I'm going to push against your shin, don't let me push you back. Excellent. And you do this on both sides. And then again, the dorsal flexes, which unfortunately you can't see, but if you were to put your foot out, I want you to push against my hand like you're driving a car, push down on the gas pedal, and then pull up with your toes. Excellent. So you provide resistance along the way. Make sure that that patient has good abduction and adduction, flexion and extension through all of their major muscle groups, checking your reflexes and checking your cranial nerves, and that will complete your neurological assessment.